Buoy Health Insights, Acute Abdomen. Hello everyone, and welcome back to Buoy Health Insights. In today's episode, we're going to dive deep into a condition that can strike suddenly and cause serious concern: acute abdominal pain. Acute abdominal pain is that severe belly pain that comes on out of the blue and just won't give up. It's totally different than the occasional cramps or a simple upset stomach. This kind of pain can be so overwhelming that it might stop you from being able to relax or even sleep. And it may be found in one specific part of the abdomen, or it could take over your entire belly. When encountering acute abdominal pain, you could also have other worrying signs. You might feel nauseous, find yourself throwing up, see blood when you use the bathroom, feel dizzy or lightheaded, or run a fever. These symptoms are major red flags and are often signs of medical emergencies. If you're experiencing severe abdominal pain, don't wait it out. Heading to the emergency room right away is critical. Now let's talk about what could potentially be causing this intense pain. Many conditions linked to acute abdominal pain are incredibly serious, and some can even become life-threatening if not treated quickly. These conditions often demand immediate medical treatment, and some may require urgent surgery. One of the potential culprits behind acute abdominal pain is appendicitis. Let's break it down. You've probably heard of the appendix, right? It's a small pouch in the lower right side of your intestines. Appendicitis is when this little appendix gets irritated and swollen, typically because something is blocking it. When it advances to this stage, you can feel severe pain around your belly button or the lower right side of your abdomen, and it's going to be super tender to the touch. Along with this, you might also feel like throwing up, lose your appetite, have a fever, experience diarrhea, and just generally feel pretty lousy. Here's the kicker. If you don't get help fast enough and the appendix bursts, the infection can spread all over inside, which is extremely dangerous. At the hospital, doctors will often tackle appendicitis with a mix of antibiotics and surgery to take out the appendix. Another condition that can lead to acute abdominal pain is pancreatitis, which is when your pancreas gets inflamed. The pancreas is in charge of helping with digestion and regulating the sugar in your blood. With pancreatitis, you might feel a sharp pain up top in your abdomen that could even creep around to your back. You'd probably again feel nauseous, vomit, and not want anything to eat. Occasionally, you could have trouble catching your breath. There is usually an underlying reason for pancreatitis, like gallstones, certain infections, drinking a lot of alcohol, or some types of medication, like diuretics. Hospital stays are common with this diagnosis to closely monitor your condition and provide treatments like IV fluids, pain meds, and sometimes even things like blood transfusions or antibiotics. And in more complicated scenarios, you might need surgery if a pus-filled pocket called an abscess appears in the pancreas. Remember, these are only a couple of the serious conditions that can cause acute abdominal pain. Diagnosis can be tricky, and often doctors will need to run lab tests, get imaging, or even do exploratory surgery to get to the bottom of it. Your health is of paramount importance, and this is not the time to take chances by guessing what the problem might be. In addition to these signs, there are also some critical symptoms that indicate you need to seek medical care immediately. If the pain is sudden, severe, constant, and increases when you move, if you're nauseous or vomiting, have a fever, experiencing vaginal bleeding, dizziness, hardness, or stiffness in your abdomen. These symptoms can mean a perforated or ruptured organ, like your appendix or intestine. And yes, it's as serious as it sounds. Now, we've covered a lot, but this is crucial information that could save lives. If you or someone you know is facing symptoms like these, don't wait. Get to the ER. And always remember to hit that like and subscribe button for more Buoy Health Insights to stay informed on important health topics like this one. Your well-being is our priority, and we're here to ensure you have the knowledge you need to make informed decisions about your health. Stay safe and see you in the next video.